The second largest meridian to be known as a stomach meridian according to the traditional Chinese medicine. According to the allopathy or the Western medicine, there are totally 72 acupuncture points are existing in the stomach meridian. By the way, now we wanted to see only the 45 acupuncture points on the stomach meridian, where precisely each and every point is the precisely location and their qualification and significant role. So we try to understand with practical orientation as well. Now let me see the first point to be known as a Chengqi. So Chengqi is the Chinese name. Chengqi is the Chengqi. If you wanted to keep it in the mind, you just keep it, otherwise you just ignore it. Make it as a ST1. ST1 for super simple way. Chengqi Sibai Juliao Dicang Jiache Xiaguan Touwei. These are the 8 points. Ren ing shui to Chi shi chu pen chu ho ku fang u I ing chuang ru chen bu rang liang men chang men kuan men ta I hor men tian shu wei ling ta chu shui tao ku lai chi chung pi kuan in si fu to su sa tu pi su san li shang chuk su tyo ko sia chuk su Fengalunga Chekasi Chungayanga Siango Ni Tingali Toi. These are the total 45 acupuncture points are there. But when I pronounce like this, so you just ignore it, because I am very familiar to tell about these names especially, then the normal names. So when whatever I tell you, if you don't understand, I'll try to tell you ST1, ST2, stomach 1, 2, 3, 4, 5. When I use the other name, if you are in confusion, then you just ask me. Otherwise, ST1, 2, 3, keep it in your mind, that's quite enough, right? So now I start from the Chengqi. Exactly the location where we need to see. Much before that, try to understand large intestine meridian. The large intestine meridian is the Yangming meridian, starts from the nail base and completed on the Alanasi. Completed on the lateral border of the Alanasi. Once you smile, you will get the crease. That crease, anterior to that crease, there is a small large intestine 20. उसे हंसते रहे तो क्या होती हैं, डिम्पल्स आ जाते हैं. We should smile it, okay? Smile करने से लार्ज इंटेस्टाइन 20 पॉइंट भी एक्टिवेट हो जाता हूँ, स्टमक पॉइंट्स भी एक्टिवेट हो जाते हैं. जितने पॉइंट्स फेस में हैं वो पूरे पॉइंट्स एक्टिवेट होते हैं. तो इसलिए मुस्कुराना, हंसना नहीं, मुस्कुराना है. तो इसके बाद मैं भी मुस्कुराता हूँ, ठीक है सकलेन? याद दिलाना मुझे, मैं सीरियस रहा तो याद दिलाना. पेशेंट के साथ अच्छा रहता हूँ, मगर तुम्हारे साथ सीरियसली रहता हूँ मैं. तो मैं बोलना सर क्लास में ऐसा बोले ना तो मैं कहीं को हंस रही नहीं, सो हंसो मेरे साथ करको बोलना. बोलते ही ठीक है ना. वो तुम्हारे वास्ते नहीं, मेरे हेल्थ के वास्ते. दैट इज स्टमक 1. द बिफोर दैट completed here. From here the chi flows to the upward. ओ इन उठ को खड़ गए, क्या मंजा नहीं बोल रही क्या कर, ठीक है. Stomach Li20 completed here. From here the chi promotes to the stomach. Large intestine energy completed here. From there the energy starts as per the organ clock theory. Yes, वो क्या होता है वो मैं समझाता हूँ. But this is stomach 1 from here to here. When we wanted to treat large intestine and stomach together, treat is the one particular point. Treating for 2 organs also recommended by using the Ing Chuang, Ing Sing and then Chengqi. Together we connect. So then Li20, stomach 1 together to be recommended. So by the way, we wanted to use stomach 1 communication through the large intestine. Then the stomach 1 is located at the margin of the infraorbital region. There is the eyes Eyes are located in the infraorbital region. Orbit is the hollow place. Inside that orbit hollow, what is existing? Eyes are existing. But this one particular one single point is located inside the orbit of the stomach meridian. There are the numerous points are located inside the orbit. Chi Ho, Ching Ming, Chengqi. Right? These are the 3 points also located. So once we wanted to apply, this should be very carefully we should apply, but in the beginners is not recommended to apply this needle. By the way, we just apply inside the orbit, so that point is located, is a very good point to treat for the oculomotor nerve. Oculomotor nerve, which is supplying to the muscles of the eyes as well, and also which is supportive for the all the vision related disorders or the eye related disorders, especially the people who are suffering for the young age generation. They are getting spectacles, they are using to overcome that problem. Definitely we can use these points as a pressure as well. But the Chinese says this is a very imperative, the alternate, because this point you cannot give the pressure, but you cannot insert the deeper level needling. That's the reason the alternate point they told. So that point I will come to know next to that. But before that, we just try to see where this particular point is located. I think you should come closer to me so that the other people also can see in the Zoom. So make sure when you are using this swab and then applying the spirit on it, so this is mechanically we do. Alcohol swab is there. In that swab there is nothing much more, but only that is the wet cotton is there. You just wipe it easily, can be possible. When we are using this cotton, because this is inexpensive, then that, right? So therefore we just apply, because the left side I select, it's the more comfortable to me here now. So I just use the stomach 1 point rather than this. I think better is this side. So right side I just select, I just wipe the entire region. Whatever the Fair and Lovely, Lakme makeup, everything has gone. It's there in my cotton. See, why you wanted to do like this, right? Good.
Sunscreen, sir.
Sunscreen, okay. So I have to change my cotton. My cotton is getting wasted. Again, I use the one more cotton, by the way. Okay. Now I just use the sterilized steel needle, stainless steel needle at the same time, which is sterilized. Now look at about the precisely, you just come and then you can see in the video. Yes, no, towards this is more comfortable. Yes, yeah. Now you can see just I am applying the one particular point, that is Chengqi. I just vertically below the pupil of the eye. The black color is vertically below the pupil of the eye, right? In the orbit, in the margin of the orbit. How to do that procedure? I push the eyeballs upward direction. I push the eyeball upward direction. So now eye has gone to the upward direction. I just am inserting. You just see very straight. Yes. Now you just see upward direction. Good. Just take deep breath. Just take deep breath. Just take deep breath. Yes. So totally 1 needle entered inside the eye. Totally 1 needle entered the inside of the orbit where the eyes is there. So now it is a very vulnerable point, dangerous point, because it touches to the eyeball, you are damaging, but shouldn't do. But even I apply to the sclera. Sclera is the white part of the eye, but you shouldn't do that. but only it is recommended to apply inside the orbit. That orbit is really good point to treat for the known and unknown etiology of the eye diseases can be treatable by activating this one particular point. But of course at the same time oculomotor nerve and oculomotor muscles, which we call as the orbicularis oculi muscles, to be regulated by activating this particular point. Right. So now the second point is Sibai, but before that this one particular point is communicating to the Renmai and then in Chiomai communicating point, and also large intestine communicating point. Now the second point to be known as a Sibai. C means is the 4, Pi means is the junction or some kind of the foramen or the communication. Now point 7 chun distal means below to the stomach 1. So this particular point is treatable for the, first we try to apply where that particular point is located. The stomach 2 point, is it really painful? Tell me honestly.
I was scared, but there is nothing.
Okay, good. So stomach 2, you try to understand there is a hollow. Hollow means is the foramen. So there is a sacrum foramen where we call as a points to be known as a Xia Changshu, Ta Changshu, Pangkuangshu, Pahuangshu. These are the 4 points are located on the sacrum 1, 2, 3, 4 foramens. Piche. But likewise, this also there is the orbital foramen, orbits foramen. In that foramen, there is the 2 hollow is there. In that hollow, this acupuncture point is located. But we need not to apply directly to that hollow, exactly apply very closer to that particular point. Now it is 1.7 chun below. 0.7 chun below, I just measure my index finger just below this. The second point is located here. The second point is located here, 0.7 chun below this particular point to be known as a Sibai. Now the people who can't apply the stomach 1 point, so that particular time definitely we can use it as a stomach 2 point as a application. Stomach 2 as a tonification. Stomach 2 as a tonification to be done. You look at about the children who are suffering, school children, for them it is required for the activation. So that particular time it is recommended to activate this particular point. Activate bilaterally. Activate bilaterally, giving the pressure like this to this particular region. Certainly this can increase the chi, increase the blood to the vision system. So therefore it is continuously recommended when it is the complication of the eye system, because eye is not super simple, you just apply it will aggravate, but it takes a longer duration to get the recover, because the retina cells or the rods and cones are not super simple to regulate in the natural form. It takes is the longer duration, but however keep activating this particular points. This will regulate all the vision related disorders, at the same time called as a blepharospasm. Blepharospasm called as a twitching of the eyes. Always they twitch like this they twitch the eyes and then relax. They twitch their eyes and then relax. So when they do like this procedure, so that time the eye muscles are the overactive. There is the involuntary. So involuntary contractions are there on the facial region, and also the people will get the face upward direction of the, called as a facial tic, is the contraction of the facial muscles to the upward direction. And the trigeminal neuralgia conditions, upper tooth pain, all are related to this. Even facial paralysis conditions can be treatable, the Sibai, the stomach 2 point. Then come to the third point called as a Juliao. Julio is the stomach 3 point. The same name to be given to the Julio, another point to be known as a gallbladder 29, GB 29 point, also the same name of the Chinese names. Only this name, two names only is the same names given by the Chinese, but the physiological aspect is different. This Julio is the point, his location is vertically below the stomach 2. Vertically below, vertically means straight below stomach 2 and lateral border of the alanasi. That means is the nose. From the nose you come like this is the horizontal, then vertically you draw like this. If madam permits, then I just draw also. However, she need to wipe. Is it okay? Not so good. So we just apply, this is the direction, this is the stomach 1, 2, stomach 3. So stomach 3, this is the point. That means this is the border, this is the vertically below. This one particular point is recommended to treat for the further numerous diseases, because it is, you are just seeing that these particular points are local points. It's not that is the greater point, this just as a local points to treat for the local disorders. Julio, that means stomach 3. We will do the practical. If the time permits, certainly we will try to do the practical orientation. Right? Now stomach 3 is the point which is useful when which direction we wanted to apply, that also matters. When the nose problem is there, so that particular time I just one particular spot just inserting towards the connected the 2 points together. One is the Ing Xiang, that is Li20, and also there is another point is stomach 3, together is activated. Together is activated. If I wanted to apply for the vision related problem, apply towards the upward direction. I just applied upward direction. When I wanted to use for the mouth related disorders, same point to be inserted on the downwards direction. One particular point, there are the 3 different directions. So you need not to apply one acupuncture point in the 3 needles you should apply. Just for the demonstration purpose I have shown you. I think everybody can see here. So that point to be known as a, just I withdraw 2 needles. Now you can see only one Julio. Julio, one acupuncture point used in the different directions. Whether the one particular point is treating for the vision related disorder, at the same time one particular point is treatable for the nose related disorders, one particular point is treatable for the mouth related disorders, and also upper teeth related disorders as well. Then I wanted to apply for the cheek muscles related problem, or there is the related what we call as a, especially the small intestine 19 is called as a Chuan Liu. So that is the very sinuous meridian meeting point to be known as a SI 18. So even the upper jaw and lower jaw, cheeks related problem having, even this also works. The same point to be applied in the other direction. I just applied on the other direction. All the 4 acupuncture needles, one particular point having the 4 different directions. Right? So then you need not to try like this, but however as a demonstration I am telling you, because the acupuncture needling methods is entirely different. Every book it says in the different concepts, but you try to understand. So which direction is required, so what kind of the problem patient is suffering, so what direction needling to be taken place, this to be very imperative. Now hopefully you have seen that is the one acupuncture point having the 4 different directions. Now the another point to be known as a Dicang. Ti means is the earth, Qiang store. So this is in fact to be known as a 0.4 chun lateral, 0.4 chun lateral to the corner of the mouth. 0.4 chun या 0.5 chun lateral to the corner of the mouth. Bilaterally acupuncture points are located. Now we applied on the right side. But what is the specific physiological aspect of this particular point? But especially for the excessive secretion of the saliva, Sialoria means excessive secretion of the saliva, that conditions, and also drooling through the mouth, or the saliva is coming through the mouth and that falls on the pillow when we sleep. So that condition also, or the people says, so whenever they talk, so suddenly they'll get the lot of saliva, they can't talk through the voice box, they talk only through the mouth, not through the voice box. So that certainly also to be regulated by activating. At the same time, the people who are suffering for the Bell's palsy and facial paralysis in the initial stages, the patient comes after 1 year, then we wanted to treat. It's not super simple. But when the patient comes in the beginning stages, definitely this is less than a month, the patient recovery will be faster. On the same day of the onset of the action, the patient is come to us, then definitely have treated less than 15 days, maximum recovery has been done, greater than 90%, 100% to the patients. When the patient comes, even today also, yesterday also I have seen one patient who came for the several years, they do have the problem. So in that case the results are very poor. But however in the beginning stages, certainly we can use this one particular point to be treatable for the mouth related disorders, speech related disorders, tongue related disorders, teeth related disorders as well. Right. So now you try to understand 4 points in your packet. Right, 4 lollipops I have given you. One is Chengqi, Sibai, Juliao, Dicang. 4 points in your packet, that is 1 to 4 in the same direction. In the same direction. 1 to 4 you have to register in your mind in the one line. Where is one line? Vertically below the pupil of the eye. You just see like this. Somebody seeing like this and then inserting is not good. Straight to straight, see, pupil is correct, upright position, then apply rightly, right? So then the Ying. Stomach 5 is the Ying. So this point is in fact not so super powerful, but however we just apply the anterior border of the masseter muscles. Masseter muscles, why is it required? Masseter muscles, what is the function of masseter muscles? Good, very good. We have to use the masseter muscles for the mastication, right, for the chewing of the food. If you don't chew the food properly, then masseter muscles are very weak, because normally we don't take gutka, pan parak, and then I don't know, masala dar, whatever we eat, right? We don't eat, no, that's the reason our masseter muscles are functioning well. I think so, right? We should eat gutka, pan parak, or yes or no? I think this the new generation, they are not eating, or eating, I know better than me. If they use overuse of this, smoking overuse of this, and chewing overuse of this, and definitely that masseter muscles will get spasticity. The internal muscles also get this spasticity, which leads to the problem of not opening the mouth precisely. So that particular time definitely we can use this one particular point to be known as a Ying. So another needle I am using, this needle to be known as a cosmetic needles. This is opening, see, this is in fact, try to see, this is 16 into 30 mm. So in fact you can see this is a red color tube is there, that means is a red color head and crown is there, and then shaft is as usual stainless steel. How to open this needle? So this you cannot open like this, right? You cannot open like this. So we have to press downwards direction, we have to press inside, then it comes out. If you don't press it down, it won't come out the needle. If you are pulling, it doesn't come. So now with the tube only it is recommended to apply this particular point. Now I wanted to use as a cosmetic acupuncture. This all cosmetic also can be recommended. You just clench. Yes, clench like this. Good. Now this entire muscles to be known as a masseter muscles. Clench like this. Otherwise, press your mouth. Yeah, you feel these muscles. These muscles to be known as a, once you press your teeth and then you see, all of you in the Zoom, you need to try all these things. Take the mirror also, you can look at on the mirror. Press and then feel that this is the muscles to be known as a masseter muscles required for the mastication purpose. Now this point is located on the anterior means front border of the masseter muscle. Clench it, clench. Yes. Now I just apply on the anterior border of the masseter muscles. Now, so in this way we just apply. So further we can further deeply we just apply. Is it painful? So even they don't feel at all. So super simple, and it is a very FDA approved acupuncture needles, and a professor has given to me this. So this particular point is treatable for the lower teeth pain, lower tooth pain, or the few gums related problem, the lower gums related issues, especially which leads to the teeth problem. Even that condition also we can treat, strongly stimulate. The next point to be known as a Jiache. You keep it in your mind, Jiache. So this Jiache, the point is located on the superior border of the masseter muscles. You just clench again. Yes, superior border of the masseter muscles. I am using another half tune needle just for your purpose. I wanted to show. So this point to be known as a Jiache. So this is in fact is the ghost point as well. There are the 13 ghost points are there. Among them this one point to be known as a ghost point, right? So ghost indicating that anything is the evil or the devil or the black magic happen on the face, on other part of the body. So that particular time we have to withdraw the ghost conditions. So certainly we can use this black magic point on the facial region. There are the another point to be called as a Renchung or the Tuituan, called as a DU26 as well. So DU26 and then stomach 6. Both the points are ghost points. So therefore this is good point to treat for the upper tooth pain and then upper gums related disorders as well. The next point to be known as a Xiaguan. Xiaguan is the stomach 7, where try to find out the zygomatic bone. Where is the zygomatic bone? So this is in fact on the anterior in front of the ear. Try to see that. Try to see on the in front of the ear. You can try to see this is the zygomatic bone. Below the zygomatic bone, vertically below the zygomatic bone, that point is stomach 7. Above the zygomatic bone there is another point, that is the gallbladder 3, Chengqi. This is a Xiaguan. Xiaguan is the stomach 7 and Chengqi, that is the gallbladder 3. So these are the points are located here. I just try to apply the stomach 7 point. Touch and feel exactly. Yes, zygomatic bone. Under the zygomatic bone the point is located. This point to be known as a stomach 7, Xiaguan, right. The last point on the head region, that to be known as a Touwei. We try to understand the point is on the head region. Only one stomach point is located on the stomach. That point is Touwei. Touwei means Toe means head, Wei means is the stomach. Stomach meridian, one point to be known as a this stomach 8, right? Where exactly the point is located? 4.5 chun lateral. 4.5 chun lateral to the anterior midline of the head, and then 0.5 chun above from the anterior hairline. I'll repeat once again. This is called as a anterior hairline. This is called as a anterior hairline. So not this. If my hairs are here, this cannot be considered as an anterior hairline. Anterior hairline, once I lift this, where my hairs starts, that where the hairs starts, that to be known as a anterior hairline. Right. Anterior hairline, and then the midline of the head. That means the called as a anterior posterior midline. Anterior posterior midline, AP line of the head to be known as a, from here to here it ends on the mastoid process, that to be known as a anterior posterior midline. This line to be known as a anterior hairline, right? In this anterior hairline, 4.5 chun away from the anterior posterior midline. This is 3 chun, right? Then another is 1.5 chun. Now this is the place. From here, there are so many hairs are here, but how to recognize this? This is very imperative. There are the proportional measurement we try to understand. From the glabella, eye of the, which we call as the eyebrows, from the eyebrows I place 4 fingers to be known as a 3 chun. What is the proportional measurement from here to here? How many chun? 3 chun. This we have to register in our mind. So same 3 chun to be analyzed from here to here. That means you just see from here to here 3 chun, 4, that means 4, from here is 1.5 chun now. Totally here is 4.5 chun. But at the same time, how to measure that exactly? From here to here, you just select 3 chun. From here to here, you select 3 chun from the bottom of the eyebrow, then you apply the point to be known as a Touwei. So this is in fact is a very beautiful point to treat for the numerous diseases.
Numerous things, for example, sir.
So this Touwei is located on the temporalis muscles. Located on the temporalis muscles. These muscles known as a mimetic muscles. This area to be known as a glabella. This area to be known as a temporal bone. But these muscles to be known as a temporalis muscles. But this point is located on the temporalis muscles. Now we know the location. The name itself is giving the information. To means head. Wei means stomach. Gastric related problem causing the headache, certainly you can use this particular point, is really good to treat bilaterally, or the unilateral also you can recommend it. But however, this particular point is treatable for the temporal headache and migraine related disorders where the sodium and potassium ions are not circulating properly on the central nervous system region. Definitely even that conditions, the people who get the epileptic fits or the convulsions, even that condition also, convulsions majorly causing the problem on the temporal muscles or the temporalis areas, that to be regulated by activating this point. Right, and also the people who having the fainting, giddiness, especially the giddiness and headache and then lethargy, even that condition to regulate the central nervous system, generally we can use the local point. And also this is in fact is the good point to treat for the vision as well, the visual cortex of the brain, even for the posterior visual cortex of the brain is the back, and the anterior visual cortex of the brain, even that also to be supportive to treat for the stomach disorders and eye disorders as well.